also blood supply of the dermis. Pigments are going to be the colors. You have a couple different pigments in skin giving color. Carotene is a yellow-orange pigment. It's what gives carrots and sweet potatoes, orange peppers, their orange color. Carotene is converted into vitamin A, and it's important for tissue and eye function. Melanin is a brown-black pigment that prevents sun damage, absorbs UV rays. You increase the amount of melanin you have with increased exposure to UV rays. And that's what a tan would be. You get tanner because you're increasing the amount of melanin that is being produced by your melanocytes. Differences in skin color would be different layers of melanin. Most people have about the same amount of melanocytes, so the number of cells doesn't really change. It's just that level of melanin or that protein that is made by those cells, giving you the different hues of skin tone. The dermal blood supply will give you the normal kind of pink color to your skin. This is from oxygen-rich blood. When you are in pain or you're angry or you're embarrassed or there's inflammation in an area, blood vessels tend to dilate or get bigger. When they get bigger, it's going to send more blood to that area. As it's doing this, more blood is red, the skin will have a more red tone to it because there's more blood in that area. When you become frightened, they constrict, reducing the amount of blood flow to that area, and you become more pale. If you have a decreased amount of oxygen, you're going to start to turn blue because you're not going to have that oxygenated blood flowing to that area. It's a sign of poor circulation. And just to be clear, blood is red inside the body. It is never blue. Blue blood does not exist in mammals. When you have an injury to the skin, there are 4 stages to repair that area. The first, you're going to have bleeding at the site because you're breaking open those blood vessels that are found in the dermis. The blood is going to fill in that hole and sealing it up, which helps prevent microorganisms and viruses from entering into the body. Because remember, the skin is that first layer of defense. In the second stage, that in the blood, there are platelets, and it's going to help form a scab. You start to have these epithelial cells start to grow down around the cut. White blood cells will start to infiltrate, making sure that they clean up any debris that might have came in that cut. Then you're going to have the clot or the scab dissolving. White blood cells leave, and then scar tissue forms. This is the scab disappearing. You have fibroblasts in here. They are starting to form those fibers for that connective tissue. And because you are forming these fibers from the fibroblasts and you're forming connective tissue, you are now putting connective tissue into a layer of epithelial, and now you're going to change the look and give you a scar. The 4th step is the scab is completely gone and the scar tissue has completely filled in. And scar tissue does not behave the same as all of the skin around it and can cause things like adhesions where the skin is not quite the same around that area. It can cause bumps up on the skin, leaving it not the same as the area around and leaving a scar for often quite some time. The sun can be very damaging to the skin, but it also can be very helpful. In small amounts, we're producing vitamin D3, which is important for calcium absorption and bone function. When we have too much sun and too much UV radiation, that is when we burn. Melanocytes help prevent that damage by absorbing the UV radiation, and our melanin will be produced in higher amounts when in the sun. But when you go just too far and your melanocytes can't keep up, you're going to start to burn that skin. Too much sun can cause things like premature wrinkling, skin cancer, and as the ozone is decreasing, we have noticed the rate of skin cancer increasing because that ozone helps block UV radiation, and since more UV radiation can get through, skin cancer incidences have increased. Sunblock and other protective clothing can help also reduce the amount of UV radiation damaging the skin. We have 3 degrees of burns when you burn the skin. The first degree burn involves just the epidermis, so this is going to be a superficial burn. It generally is characterized with redness, edema, which is swelling, and pain. And it's generally treated with cool water. Just run it under some cool water to help reduce some of that pain and redness. A second degree burn involves the epidermis and part of the dermis, so this would also be called a partial thickness burn. You have the same symptoms as the first degree with pain, edema, redness. You're also going to start to have blisters. A blistering burn is going to be a second degree burn. Most burns you get from the oven or like a flat iron or curling iron is going to blister and be a second degree burn. Oftentimes, second degree burns leave scars. Sometimes it is treated with medication and sterile dressing, depending on how much of the skin was burned. Generally, a little oven burn is not going to be treated medically, but something like this picture here will be treated medically. And a third degree burn involves all the layers of the skin. This is called a full thickness burn. Here we have loss of skin, eschar, which is blackened skin. Generally, this is no pain because you have burned all of those pain receptors away, so there's nothing to feel, or no receptors to feel pain. Generally, it is life-threatening because now you've taken away that barrier that helps protect and maintain homeostasis. You've lost that, so it's easier to get infection. It's easier to lose water and become dehydrated very quickly. It often requires a skin graft, antibiotics, and being in a sterile environment. This would be an example of a third degree burn. Let's take a look at the ABCDs of skin cancer. There are 4 things to look at when looking at markings on the skin to look for skin cancer. The first would be A. A would be asymmetry. If one half of the mole or freckle does not look like the other half, it's asymmetrical. That is a telltale sign that it could be skin cancer. Look at the border. If it's not smooth, if it's irregular or scalloped, its border is very uneven. Another sign of skin cancer. Coloration. Generally, a freckle or a mole should be solidly colored. If there's variations of different colors, maybe we have some black or white or blue or red. Any of these variations of shades are indicative of skin cancer. And then the diameter. If it's larger than 6 millimeters or larger than that of a pencil eraser, so if you can take a pencil and put it on there and it's bigger, it could also be indicative of melanoma or skin cancer. Let's go ahead and look at the accessory structures of the skin. We have sweat glands, sebaceous glands, hair, and nails. For sweat glands, we have 2 types of sweat glands. We have apocrine. Apocrine are generally found in the armpits, nipples, and groin. These become active at puberty, and they are the ones that tend to stink. Most of the time, what you're smelling is the waste product of bacteria that is living off the secretions of the apocrine glands. And then we also have merocrine gland. Merocrine glands are the most common type of sweat glands. They respond to elevated body temperature, secreting sweat when you become hot. They're all over the body, but on the palms of your hands and the soles of your feet they are most numerous. And they can produce about a gallon of sweat per